General, how are you?
I'm great. Thank you, Senator.
In America, unlike other countries, where they let you die in a ditch, in America, if you're too poor to be sick, we'll pay for your doctor. Isn't that right?
It is.
And one of the programs we do that through is Medicaid.
Correct.
Okay. And this money for Medicaid, it didn't just fall from heaven. We thank heaven for it, but it came out of people's pockets, didn't it?
Every dime of it.
And some of that money is stolen, isn't it?
Yes.
And the states, not all of them, but many of them, allow it to be stolen, don't they?
Yes.
Let's take Medicaid in California, for example. I don't mean to just pick on California, but because this happens in other states. We saw it happen in Minnesota, for example. But in California, for every dollar that the California state government puts up for Medicaid, for the Obamacare portion of Medicaid, the federal taxpayer puts up $9, don't they? And so, is that right?
That's correct, Senator.
And so as a result, California has allowed thousands and thousands of these social assistance and so-called health care providers pop up in California, haven't they?
Yes.
And some of those providers steal the money, don't they?
Yes, we know that to be true. Yes.
And the money never gets to the people they supposedly are trying to help. Isn't that correct?
That's correct.
And the other way that California and others abuse the fact that they're putting up $1 and the American taxpayers putting up $9. Did I mention it was $9?
I think some say it's even more, but yes,
Yeah.
9 work.
They expand the services, don't they?
Yes.
Because some states, like California, I don't want to paint with too broad a brush. It's not everybody in California state government, but it's a lot of them. They see this as free money, don't they?
They're not paying for it, yes.
Isn't it a fact that, for example, Medicaid in California will pay a provider to provide tribal prayers? I looked all this up.
I mean, I'll accept that. I didn't know that, but yes.
That California will actually pay a health care provider, I didn't know this was a medical expertise, to pay for exorcisms. Is that right?
I'll accept that, Senator, but that's...
In a tense and highly publicized Senate hearing, Senator John Kennedy questioned Deputy Attorney General nominee Todd Blanche about reports concerning California's Medicaid program and allegations that public funds may have been used for unconventional services, including exorcisms. The exchange quickly drew national attention as Senator Kennedy pressed for clarity on how taxpayer money is being spent and whether adequate oversight exists within state-funded health care programs. During the hearing, Kennedy expressed concern that Medicaid resources, which are intended to provide essential medical care to low-income individuals and families, could be directed towards services that many Americans would not consider evidence-based medical treatment. He repeatedly emphasized the importance of accountability and transparency, arguing that taxpayers deserve to know exactly where their money is going. Blanche, while responding carefully to the senator's questions, noted that health care funding, regulations, can be complex and often involve state-level decisions operating within federal guidelines. The discussion highlighted broader concerns about government spending, health care policy, and the balance between religious practices and publicly funded services. As clips of the exchange spread across social media and news outlets, many viewers were left debating whether the issue represented a serious misuse of public funds or a misunderstanding of how certain health care and counseling services are categorized within Medicaid programs.
The California Medicaid program will pay for herbal medicines, meal deliveries. They'll pay for housing. I don't know what housing has to do with health care. Is that correct?
Yes.
Were you aware that the Medicaid program using federal money, taxpayer money, will pay for an in-home chef?
Yes.
Okay.
Even if it's a family member, yes.
Yeah, they'll even pay for gymnasium fees through Medicaid in California. They'll pay for bicycles, scooters, gym memberships. Did you know that?
Yes, several states do, but California does for sure.
They'll even repay your student loans. Were you aware of that?
I was not aware of the student loans repayment.
Yeah, they'll repay somebody's student loans to encourage them to become a health care provider. I mean, California, they're just setting all kind of records. These folks are they're wild people. California's got 12% of the population. In the last 10 years, they're responsible for half of these new so-called health providers to provide exorcisms and other things. Now, what the hell are we doing about it? Why has this gone on for so long?
Senator, listen, it's a great question. And what you just described are programs that are allowed under the program. You have a whole other issue in California where a lot of these folks are just stealing the money, not even running it through for exorcism.
They're thieves, aren't they?
They're thieves, correct.
And California just watches it happen, don't they? Not everybody in California. The government does, doesn't it?
Well, that's the challenge in a lot of states, is that we don't have a state government, which you all have entrusted to run these programs and take care of the money that you all give them. There's state structures that absolutely do not do any compliance, and they don't do their job.
Because they don't have no incentive to. They're getting free money. Isn't that right?
Yes, I think so, yes.
We got to change this, General.
We're trying.
I call this a slush fund. You want to talk about slush fund? This is a tier 1 slush fund that's been going on for years and years and years. Billions, hundreds of billions of dollars is stolen.
Yes, Senator, and that's why, look, this department stood up a whole new fraud division, and AUSAs around the country prosecute fraud every day. So it's not as if we didn't have the work out there, but it's so systematically taking money from the American taxpayer that we very much believe that it needs its own stand-up structure, and I think it's true for the reasons that you just said.
If you need an exorcism, you can go to California, can't you?
Thank you, Senator.
The hearing sparked a wider conversation about the role of government oversight in healthcare spending and the responsibilities of federal officials in monitoring state-administered programs. Supporters of Kennedy's questioning argued that lawmakers have a duty to investigate any spending that appears unusual or controversial, especially when taxpayer dollars are involved. They viewed the senator's line of questioning as an attempt to ensure that public resources are being used effectively and in accordance with established healthcare standards. On the other hand, some observers suggested that the discussion may have oversimplified a complex issue, noting that reports about exorcisms and similar services often require additional context regarding how such treatments are documented, approved, or reimbursed. Regardless of differing opinions, the exchange succeeded in drawing attention to the broader debate over Medicaid spending, healthcare accountability, and government transparency. As policymakers continue to examine healthcare budgets and program requirements, questions about oversight and appropriate use of public funds are likely to remain a significant topic in Washington. The hearing serves as another example of how a single exchange between a senator and a government official can ignite national discussion, influence public opinion, and bring complex policy issues into the spotlight. For many Americans, the debate is not only about one specific claim, but also about ensuring that government programs operate responsibly, efficiently, and in the best interests of the people they are designed to serve.